Hi, my name is Dhadley. I'm also known as the social leadership guy. My background has been as somebody with lived experience of problematic use of drugs, which ravaged my life, took away my innocence, and made life very difficult for me to live with any great meaning or purpose. So after I detoxed and got married, it was a really good opportunity for me to kind of revisit who I was, do things that I'd always wanted to do, but it must be said that there weren't many people that were supporting me in terms of this transition, so it was really a journey of self-discovery. That took me to volunteer at a couple of different organisations, ones that I had some sort of association with. So one was a drug treatment service, where I'd make people cups of tea and play pool with them. It was also an opportunity for me to share a bit about my recent past and talk about some of my dreams for the future. But more so than that, it was an opportunity for me to learn about the experiences of other people. I think when I was in the grips of addiction, the only type of conversation we would have would be around, well, who's live, in other words, who's got drugs that we can buy, talking about things on that level. But because I've been able to deal with kind of my demons, albeit it was not long after I detoxed, I started finding out more about not just people's use of drugs or alcohol, but about them as human beings, about their lives, about what had happened to them, some of the ways in which they were not having their needs met by services. Which leads me on to the other volunteer placement that I had was with a brand new organisation that had been set up to consult with people accessing drug and alcohol, mainly at that point drug treatment interventions in the criminal justice system within the community. So that was much more focused on finding out about people's experiences, feeding them in at a strategic level, with a view to then things changing as a result of people's needs not being met and how they could be met. Within 5 months of volunteering at both, I progressed from a volunteer to project worker to leader in a leadership role as a manager of an organisation called Suit, which was the one that consulted with individuals that use drugs and drug treatment. And then the next kind of phase of learning came through continually attending strategic meetings, initially being very confused about some of the language, about some of the context, about why if somebody said that this isn't working then this would happen straight away. I started to kind of understand a little bit more how to act in a, dare I say, a professional way with diplomacy. Now in the back of my mind throughout all this process, my hopes and aspirations were to see the lives of other people improve. So although certain conversations wouldn't necessarily correlate to wholesale change, I had to be very patient, but also have the confidence to ask what certain things meant, why were these acronyms being used, what do they mean, and to understand the context behind what people were saying. So through the process of learning and finding out more about how the strategic environment was operating, that started to give me a real sense of context. So this wasn't changing, and these are the reasons why, and the funding stream works in this way. But then the next kind of realization I had was that there was a massive disparity between strategic and political aspirations and the experiences of people that, like me, were having difficult times with drug addiction. So again, patiently I'd wait for services to change their delivery model, or to be more understanding or person-centered around individuals' needs. But rather than waiting for other services to change, which I realised would take quite some time, I actually then developed Suit so that we could actually meet individuals' needs by harnessing and tapping into the different resources that existed. So, for example, I would never suggest that we were a housing specialist provider, but people, by opening our arms to the community and welcoming people, we would signpost and support people to access these specialist services, but say, well, actually, that's not the end of it. So once, let's look at your housing, but you've also got quite a lot of debt. You're having some issues with your key worker at the treatment service. So we would very much base our delivery model with the individual at the centre. And by doing this, then, obviously the people that we were serving and working alongside would be really appreciative, because they'd feel as if they had an advocate on their side. But then also, unintentionally, we started making quite inefficient and cumbersome systems much more efficient, and work, in ways perhaps they wouldn't do without that type of approach. And this model proved very successful. We worked with hundreds of people every year. We delivered thousands of different type of interventions and worked in true collaboration. I use that term loosely, but if I mentioned the example of a housing specialist, but there'd be the exact type of services for employment, for mental health, for physical health, for obviously drug and alcohol treatment services, and each year we would work with hundreds of organisations, so that the individuals accessing our service could get the help and support that they needed, and that for me was the proof in the pudding. For that would be the experiences of individuals, the number of people not just necessarily stopping their drug or alcohol use, but those that could then start attending appointments on time, that could have a better quality of housing, that had better relationships and social networks, all the things that sound good and the right thing to do, but often with the way in which services are commissioned, designed, and formulated, unintentionally they create silos, which puts the emphasis on the individual. So in essence, what we did is we flipped it and put the individual at the centre. So during my time at Suit, I very much was involved in local strategic meetings, but I would always ask questions that superseded the understanding or remit of people in that room. And one typical example is of a time that I was sat as a representative in the local police and crime board, where one of the questions I asked was, how do we tackle the disproportionate sentencing of black and Asian individuals within the criminal justice system? To which the response was, well, that's not something we can answer in this room. But I've always been the type of person that would say, well, actually, if you can't answer it, then who can? So I started progressing from very local meetings to regional to national. I waited patiently for 5 years to be invited to a all-party parliamentary group, for example, on alcohol, drugs and justice. And each time I would enter a new arena, I would still have the same childlike curiosity about who was in the room, what they knew, could they change things? And that was very much directed by my lived experience, but also the experiences of, not just the hundreds or thousands of people I work with, but the hundreds of thousands of people that have been affected by systemic failings across the UK. I left Suit in January 2019 after 12 wonderful, magical years, and my motivation to do that was to grow as a strategic influencer, was to see how I could work much more with systems, having developed a model that was, dare I say, groundbreaking in terms of the difference that we were making in people's lives, in spite of the systemic blockages and barriers that people faced. So the natural transition for me was to then, what could I do to try and influence the systems in a much greater way? So since leaving my role at Suits, I importantly took a bit of time out to be full-time dad, which I'm glad that I did, because that time I'll never get back, and hopefully it'll be something that's imprinted in the minds of my 3 young children. And now I've set up as a consultant where I've worked with various stakeholders, such as like the homelessness sector, where I've written guidance on how to support people accessing homelessness services who use drugs. A similar piece of guidance around naloxone and why naloxone should be more widely available. particularly within people suffering from homelessness. I'm the current independent ambassador for the Labour campaign for drug policy reform. I've had blogs published by the Conservative equivalent. So I'm working on a number of projects, some that are very much linked to the world of drugs and drug policy or social deprivation, and some quite exciting areas where I see systems like the corporate sector, for example, playing a much greater role, where I see the corporate sector playing a much greater role in how they, through their social impact endeavours, can support public sector, not-for-profit sectors, to try and kind of provide not just the much needed injection of cash, but also how can we bring together the expertise that exists from different sectors to try and help society to move forward.